I'm Joseph Alpert, the editor-in-chief of the American Journal of Medicine, and I'm here this month to call your attention to what I thought was a really interesting article. It comes from Europe, from basically all of the EU countries and then some, in which they looked at the emergency room acute admissions during the pandemic, during the COVID-19 pandemic over a period of about 6 months. And what they discovered was, by the way, the same thing we're seeing in the United States, that there's a marked decrease in acute admissions. For example, acute admissions for myocardial infarction, acute admissions for stroke, all of them are down. Now, I don't want to have you think that the COVID is curing these people. In fact, what's happening is people are staying home with very serious illnesses. And so for the last 7 months, I've been doing a lot of inpatient work to help out with the huge surge we've had, not on the COVID floors, but on the other internal medicine floors. And the folks we're seeing, I can tell you, are a lot sicker than the folks we saw at this time a year ago. And it's because they're delaying. They're afraid to come to the hospital. Even though I keep telling people, you are safer here in our hospital than you are when you shop in the supermarket, because you don't know who's standing next to you in the supermarket. And we're all vaccinated, we're all masked, we're gowned, we're gloved, we're squirting our hands with disinfectant and washing frequently. And the hospital has tripled the amount of cleaning. And I'm sure that's true for every hospital across the country. So the message here is to tell your patients, please, if you feel sick, go to the hospital. You're safer there than you are if you're just trying to tough it out at home. This is the first author was Sokolsky, but it's a huge number of European authors. And actually, we got this because Jeroen Baks from the Netherlands, who's a good friend, former head of the European Society for Cardiology, called me and said, I have an interesting article that I think people in the US would be interested in. And he was absolutely right. An excellent article. So I look forward to having you read that. You can follow it also on our website and our social media. And thanks very much for reading the American Journal of Medicine.